In the fifth and final section, now let's go to the management of sleep apnea, in which very important are the lifestyle changes we can do, easily managed changes that can be done to treat the sleep apnea. Positional therapy and intraoral devices, and also CPAP, which is continuous positive air pressure that can be used at night during the sleep, that helps to improve the breathing and overcome the problems like hypoxia. So non-surgical treatment options, lifestyle changes, very, very important lifestyle changes should be done. Positional therapy, intraoral devices, and CPAP. All these are the non-surgical treatment options. Surgical options we mentioned like adenoidectomy, tonsillectomies, uvuloplasties. All those are the options or managements we can do for the treatment of sleep apnea, which are the surgical managements. Now the non-surgical are all these lifestyle changes, positional therapy, intraoral devices, and CPAP. Intraoral devices, these are the oral appliance that pulls the lower jaw forward, opening the airway. So if the jaw position or the shape is not correct, that is causing obstruction of the airway, we do the intraoral devices. These are like the implants, conventional implants and mini implants. Conventional, they have a hollow wider screw with changeable parts. So this is conventional implant. That's the mini implant, which have solid narrow screw, comes in one piece. So this one here, we can separate the screw and we have changeable parts. This one is the fixed, we cannot change the parts, and different these implants are implanted, and the purpose of these implants is to fix the shape of the jaw so that obstruction is relieved that is causing the obstructive sleep apnea. CPAP, another, is used during the sleep, that gives the continuous breathing, helps in continuous breathing, and that is also very, very helpful in obstructive sleep apnea. Especially the consequences of obstructive sleep apnea will be overcome, like heart failure, respiratory failure, and then we have with the use of CPAP, person sleep through the night and they are not irritable, they are not fatigued in the morning, they don't have sleepiness during the day. So all these are treated by the CPAP, in which there is continuous supply of air and breathing is continuous. Surgery can also be performed for the treatment, and the one we mentioned, uvulopalatoplasty, tonsillectomies or adenoidectomy, all these are common procedures that can be performed in the routine, and also especially if they are leading to the obstructive sleep apnea, because we discussed already they have so many characteristics associated with them that we need to manage the underlying cause of obstructive sleep apnea. Tonsillectomy, adenoidectomy, septoplasty, repair of the septum, removal of the septum, resection of the septum, different methods can be used for the deviated nasal septum. Advancement genioplasty with hyoid suspension. That's another procedure in which the hole is made and then the hyoid bone suspension is done. That is also used for the treatment of obstructive sleep apnea, and that is helpful in opening the airway and relieving any obstruction that can cause obstructive sleep apnea. Tongue-based radio frequency, again, this is the tongue, and then we have enlarged airway space. The radio frequency is used for the removal of a large tongue base. Large tongue base is also the cause of obstruction, and the treatment will only be decreasing that obstruction by tongue-based radio frequency, and you can see that increase the airway space and relieve that obstruction that can occur. Maxillomandibular advancement osteotomy. Osteo is for the bone, otomy is the opening. So in this, the fixation of maxillomandibular, upper and lower jaws are fixed, so their position should be that if they are displaced backwards, so they are pulled forward and they are fixed in that position by different screws, that the position remains in place, and that can also help in the going backward or deviating backward and causing obstruction of the airway. So this is also one method, advanced method of treating the obstructive sleep apnea. So we have procedures, from simple procedures like daily lifestyle changes, positional changes. Ask the person what position usually they sleep in. Ask them to lie on the side, don't lie straight. So we have maneuvers for the treatment of obstructive sleep apnea, from simple maneuvers like lifestyle changes, positional changes. Then we start from minor surgical procedures like tonsillectomy, adenoidectomy, septoplasty. All these are simple maneuvers. But then at the later stage, if there is defects in the skeleton or in the bones, we need to treat them by the fixation maneuvers, and that also helps in the relief of the obstruction that cause obstructive sleep apnea. And that obstructive sleep apnea can have so many effects like congestive heart failure, respiratory failure, irritability, decreased libido, restlessness, increased roadside accidents. So these are the characteristics associated with obstructive sleep apnea, and we need to manage this for the betterness of more serious conditions. So that concludes our topic, in which we discuss in detail the snoring and obstructive sleep apnea. Thank you for watching sqadia.com.